The importance of qi for the nursing mom. Kuala Lumpur, August 3. Most mothers-to-be would assume that when it comes to breastfeeding, the milk would flow effortlessly, and the process would be stress-free for both mother and baby. Why would it not be when you read so many articles on how breastfeeding is a natural process and when other women share their positive experiences on social media lactation groups, supporting one another in the process? The reality though? Breastfeeding is challenging and many women struggle with the entire process. It is overwhelming and can be an exhausting experience when you are trying to recover from giving birth and having to tend to a newborn at the same time. The pressure is immense. One cannot help but wonder if she has failed to do what is supposed to be natural as a mother. Some women may have given up the entire process, but if one still wishes to try to breastfeed, there are many ways to overcome lactation challenges. For the baby's health and well-being, a natural solution is always the preferred choice. One such choice is Chinese medicine, as it offers a natural solution through its holistic approach. In general, there are two categories of lactation challenges: low milk supply and poor milk flow. Chinese medicine practitioners attribute low milk supply to insufficient qi and blood supply in the mother, which is related to her body constitution. Mothers experience birth injury and excessive bleeding during childbirth, be it through natural birth or cesarean delivery. This causes qi exhaustion, hence leading to qi and blood deficiency and stagnation in a postpartum woman, explains Sinian Suan, a practitioner at the Imu Healthcare's Chinese Medicine Center with 10 years of clinical experience. This stagnation prevents milk from expressing naturally, and eventually causes breast fullness, distension, pain, and engorgement. Postpartum stress can also affect your qi, says Sen. In Chinese medicine, we recognize the main cause of disease is due to a deficiency in the heart and spleen, internal obstruction of blood stasis and stagnation of the liver qi. Emotions play a part in the health of the heart and spleen. Constant worrying hurts the spleen and exhausts the heart, which will then affect the generation of qi and blood, leading to postpartum depression. Hence, Chinese medicine treatment emphasizes mainly on regulating and harmonizing the qi and blood, calming the mind at the same time, says Sen. Chinese medicine practitioners do recommend complementing modern medicine with Chinese medicine when treating lactation challenges such as mastitis. While antibiotics help with clearing up the infection, Chinese medicine or acupuncture can treat the blocked qi that is causing inflammation, swelling and pain. You may wonder though, is it safe to consume herbs while breastfeeding? The answer is, yes. It is safe, as most Chinese medicine herbs are plant-based. Generally, herbs prescribed to mothers are safe to take during breastfeeding, says Go Siwai, a practitioner at the Imu Healthcare's Chinese Medicine Center specializing in women's health. However, you do need to avoid some herbs while breastfeeding. For example, fanziyi, senna leaf, dahwang, rhubarb, and huangqin, Chinese skullcap, as these herbs contain high levels of alkaloids that may lead to difficulty in breathing, low body temperature, and a loss in appetite for the mother. Also avoid jiaomaya, barley sprouts malt, and Szechuan pepper, as they can stop lactation altogether, says Go. Before taking any Chinese medicinal herbs, it is recommended that you consult your Chinese medicine practitioner for a personalized and targeted recommendation. It is also common among Malaysian women to observe a traditional confinement period, as it is believed to be necessary for the new mother's care and recovery after childbirth. During this period, the most common treatments offered are a special diet, herbal medicines and postpartum massage therapy. Postpartum mothers will take at least a bowl of herbal soup daily during the confinement period. The function of the herbal soups is to help with qi and blood recovery as well as to promote lactation. Herbs that can induce breast milk secretion include Wang Bu Liu Xing, Vaccaria seeds, and Tonkao, rice paper pith, shares Sen. She however warns against acupuncture during this confinement period. Acupuncture is mainly used to induce strong stimulations on certain pressure points. Health-wise, new mothers often experience deficient conditions, making them weaker. Acupuncture may lead to fainting or excessive bleeding issues if performed during confinement, she says. Once you're past this period though, acupuncture can help to improve the production of breast milk. A holistic approach. Whether it's modern or Chinese medicine, one thing that can help with breastfeeding is this: the well-being of the mother, both physically and psychologically. When one is in good health, the body will then be able to function as it should. So, when a new mother eats well, gets enough rest as well as is emotionally calm and relaxed, breastfeeding can come easily. As for diet, from the perspective of Chinese medicine, Go recommends avoiding raw and cold food like sushi and salad as well as cold drinks during breastfeeding. In addition, the nursing mother should not be on a diet to lose weight. A balanced nutrition supplements the qi and blood, which can provide sufficient breast milk. Take a balanced diet of moderate high-fat food, fish, eggs, lean meat, and other high-quality protein. Eat more fresh vegetables, fruits, whole grains, and nuts to guarantee the vitamins, mineral and dietary fiber intake. Also, drink plenty of water for milk production. Generally, an adult woman should drink 1.5 liters of water every day. To produce sufficient breast milk, a nursing mother should drink that and an additional 750 milliliters of water, she says. Her other recommendations? Get plenty of rest. The synthesis and secretion of milk are affected by many hormones. Adequate sleep and rest are conducive to hormone balance. Poor quality of sleep affects the heart and may affect the blood. This can result in the quantity of breast milk. Also, maintain a good mood. New mothers are prone to stress and anxiety, which will affect milk secretion. Mood fluctuation will affect the liver qi easily, and this can prevent the qi from flowing properly, thus affecting breastfeeding.